My name is Dr. Rodriguez. I am a weight loss doctor in weightrx.org. Did you know that semaglutide is a glucagon-like peptide 1, GLP-1, receptor agonist that has gained prominence for its role in promoting weight loss? One of the key mechanisms through which semaglutide supports weight reduction is by promoting a sensation of early fullness, also known as satiety. This physiological effect is achieved through several interconnected pathways involving the gastrointestinal system, brain, and metabolic hormones. Semaglutide slows the rate at which food leaves the stomach and enters the small intestine, a process known as delayed gastric emptying. By prolonging the time food stays in the stomach, semaglutide helps individuals feel full for longer periods after eating. This delay reduces the frequency of hunger signals sent to the brain, discouraging overeating and snacking between meals. Semaglutide mimics the action of the natural hormone GLP-1, which is released by the intestines in response to food intake. It binds to GLP-1 receptors in the hypothalamus, a region of the brain responsible for regulating appetite and energy balance. Activation of these receptors suppresses appetite by enhancing the brain's perception of satiety, making individuals feel satisfied with smaller portions of food. By activating GLP-1 receptors, semaglutide also influences other hunger-regulating hormones. For example, it suppresses the secretion of ghrelin, often referred to as the hunger hormone. Ghrelin is typically released when the stomach is empty, signaling the brain to stimulate hunger. By reducing ghrelin levels, semaglutide diminishes the intensity and frequency of hunger signals. Enhances meal-related satiety. In addition to reducing hunger, semaglutide enhances post-meal satiety. It increases the release of insulin in a glucose-dependent manner while reducing glucagon secretion. This dual action stabilizes blood sugar levels after meals, preventing the rapid spikes and drops that can lead to cravings or a sensation of continued hunger even after eating. Beyond physiological hunger, semaglutide also appears to impact psychological factors related to eating. It reduces the brain's response to food-related cues, such as the sight or smell of food, which can trigger cravings. This dampening of food reward pathways contributes to decreased caloric intake by reducing the desire for high-calorie or highly palatable foods. Clinical studies have demonstrated semaglutide's effectiveness in promoting early fullness and sustained weight loss. For example, in trials like the STEP semaglutide treatment effect in people with obesity series, participants treated with semaglutide reported significant reductions in hunger and increased feelings of satiety compared to those receiving placebo. These effects were often accompanied by a noticeable decrease in caloric intake, underscoring semaglutide's role in appetite regulation. The promotion of early fullness through semaglutide has profound implications for weight management. By helping individuals feel satisfied with smaller meals, semaglutide reduces overall calorie consumption, leading to a negative energy balance and gradual weight loss. This approach aligns with sustainable weight loss practices, as it avoids the need for severe caloric restriction or excessive willpower to combat hunger. While semaglutide's promotion of early fullness is beneficial for weight loss, it is important to monitor its use under medical supervision. Delayed gastric emptying, for example, can sometimes lead to gastrointestinal discomfort, including nausea or bloating. These side effects are typically mild and diminish over time as the body adjusts to the medication. In summary, semaglutide promotes early fullness by slowing gastric emptying, modulating hunger and satiety hormones, and acting directly on the brain's appetite-regulating centers. These mechanisms work synergistically to reduce hunger, enhance satiety, and support sustainable weight loss, making semaglutide an effective tool in managing obesity and related metabolic conditions.
For more information on this topic, please subscribe to our channel or text our clinic number. Brought to you by weightrx.org.